Hi, good afternoon, everyone. A very, very warm welcome. We are glad you join us today on our Facebook Live. I'm Sharmila Parantaman, and I will be your moderator for today. Before I introduce the speaker for today, just a little reminder if you have any question during the talk, feel free to type them in the comment box below in the live stream. I'll bring the questions up during the Q&A session and they'll be answered by the speaker. And also, don't forget to like and share this video with your friends and family so that they can join us and benefit from the live chat. Okay, a smile from a stranger, we feel accepted. A hug from someone, we feel comforted. Having a meal with friends, we strengthen our bonding. A holiday rejuvenates us. Kids socializing in school helps in their growth. But now, we are all confined to restrictions. How do we get over this together? Remember, we are all in this together. Today, we have someone who is an expert in this field to give us some mental health tips during this pandemic. It's an honor to have with us today an esteemed and experienced speaker, Professor Philip George, who is a consultant psychiatrist and addiction specialist who teaches and practices in various institutions. After graduating with MBBS in 1988 from Manipal, India, Professor George pursued his master's in psychiatry in 1996 at University Kebangsaan, Malaysia. He also completed a certificate in substance abuse with the University of Melbourne in 2003. His area of interest include prevention of substance abuse, managing stress and depression. I'm a big fan of Professor Philip George. I look forward to his live talks on Light FM on Wednesday mornings on Mind Matters, especially on children's psychology. Let's welcome Professor Philip George.
Hello, good afternoon, everyone. Hello, good afternoon, everyone, and thank you so much, Sharmila, for that introduction. I will take extra care to make sure my Wednesday talks are better on radio. But yeah, thank you for having me today to talk to you on a very important topic. I actually used to do these talks before, but they were very rare and very far apart. Mental health took a backstage for many, many years. And I remember actually offering to do these talks for my healthcare professionals, my colleagues, and for the public. And very often it was not very well entertained. Now I'm doing a talk almost every week. I think, something's changed to make us actually feel and think that mental health is an important component of our lives. In fact, there is no health without mental health. So, I'm going to touch on some of the mental health tips during COVID-19 that we can all maybe sort of come to understand and know and manage on our own as well. But I'd like to also touch on what are the things that are triggering mental health problems in all of us currently during this pandemic and through our lives as well. What are those triggers for mental health issues? So, as I mentioned, I think in the past it was always put in the back seat and not really focused on. It was an issue that people just didn't want to spend time thinking about. There was too much taboo, stigma, and prejudice. But now with this COVID pandemic, we know that it has an impact on everyone, not just those with mental illnesses, but even others who have been impacted by lockdown and all the other effects of the pandemic as well. In fact, Victor Seng, who is an assistant professor in pulmonology and critical care in the US, suggested that there is this fourth wave. These are the waves of health footprint of a pandemic. So they're different from our current third wave that we're going through of the infection. They're the health footprint of the pandemic. The first wave of any pandemic is actually the immediate mortality and morbidity related to the COVID-19 infection. And as that comes down, you have the post ICU recovery. But the second wave is really the impact on resource restriction on urgent non COVID conditions. So people who have been scheduled for surgery, for example, they've been delayed, or their surgery can't happen currently, or they have other medical problems that need attending to, and they can't come out of their house or go and visit their doctors as they want to. The third wave is the impact of interrupted care on chronic conditions. I know my neighbor during the first lockdown ran out of his hypertension and diabetes medication. And so I helped him to actually get these medications because the hospital had delayed his next appointment and he couldn't get any more supply of his medications. But this impact is real and it happens all around us as well. But the fourth wave is the psychic trauma that it actually entails. The trauma that comes from going through this whole period of pandemic and the lockdown and everything else that's related to it as well. I think we all understand that there's issues like economic and marital issues and even burnout that are related to this pandemic. Now, how common is this in our community? Well, actually, sadly, in our last National Health and Morbidity Survey, we were identified as having about a third of the population suffering from a mental health problem. So even before the pandemic, mental health was already a significant issue in our country. It did not spare people from different age groups. In fact, teenagers also had high rates of mental health problems. 11.2% had suicidal thoughts, and 10.1% of 15 to of 12 to 20-year-olds actually tried to commit suicide. So, what is mental health? Well, first and foremost, there's a big difference between mental health and mental illness. Mental health is everyone's issue. Like it or not, we have good mental health and bad mental health. You may wake up in the morning and feel very positive and cheerful and happy about the day and go about your business for the day in a positive way. But you may have poor mental health if, for example, you've had some bad news or you're feeling under the weather and your mood is not the same as the previous day. So mental health is very dynamic. It can be positive and it can be negative. It determines how we basically manage stress, how we relate to others, and even make choices for ourselves. But poor mental health is a precursor for mental illness. In fact, it's not just poor mental health, it's just not mental illness that it can trigger, but it can also trigger medical conditions. We now know that poor mental health can actually increase the risk of hypertension, diabetes, cancer, and heart disease. And so, if you're not actually engaged or involved in building your mental health, you can be at risk of developing multitude of illnesses, even if you control your diet and exercise and do all the other physical things to prevent illnesses. Of course, combine that poor mental health with other factors like biological factors. I mean, if there is a genetic factor, or there is a brain chemistry that's altered, or you've had some experiences in life, some such as trauma or abuse, or even bullying and shaming as a young person. All of this combined together with poor mental health then can trigger an increase in mental illness. Of course, we also see this happen with people who use substances occasionally as well. So, what are the specific causes in this pandemic? Well, actually, it can be numerous. It can be the effect of social distancing and the loneliness. I mean, when we're in lockdown, we're not allowed to go and visit our friends or family. Some people are separated, even spouses are separated, and that can have a huge mental health impact. We know that this loneliness and social distancing actually affects the different age groups differently. In fact, the people who are most affected are the young. Youth and teenagers are really affected by this, and so too the elderly. So the extreme of ages actually see a bigger impact from social distancing and loneliness. Study and working from home That's not something that we're all used to. We've never done this before. And so, trying to change our lifestyle to actually accommodate for this can be a real challenge, especially when the environment is the same, the home environment and the work environment. You wake up, you open your laptop, and you're doing the same thing, and then you put your laptop off and you go to sleep. And if you don't have any separation between work or study and your home environment, you can actually make the whole process very stressful for yourself as well. So, what we often advise is try and make the work or study environment separate from especially your bedroom, because the bedroom is meant for a place to relax and de uh, de-stress once the day is over. Also, put specific times for your study and work. Have a schedule that helps to be resembling what it used to be when you used to leave the home to either study or work. The other thing that also can impact on our mental health is this COVID-19 information overload. Is the vaccine effective? Is it not effective? Is it doing this? Is it bad for us? Is it good for us? I mean, that's confusing, right? So we need to identify where to get our information from, a resource that can be trusted. In this day and age, with social media, a buzz with so much information, we can be pushed information that really is not accurate. Of course, the COVID 19 pandemic and the ensuing lockdowns have also caused financial strain, job loss, or pay cuts. And that can be a new struggle for people as well. Being at home 24/7 can also lead to relationship issues, especially if the relationship was not in a good footing from the beginning. And we've seen increase in domestic violence or parental problems. And even when things are opened up, there's that anxiety about, is it safe to go out? Is it safe to take my mask off? So that total defense can be something that can trigger emotional changes in ourselves as well. I think we've all heard and experienced morbidity or even death in this period of the pandemic. I've lost two close relatives to COVID 19. My own godfather, who thankfully I visited 2 years before in the UK, he passed away on his own in a hospital. And it definitely had an impact on the whole family, as they were not allowed to grieve how we would normally traditionally do. So that definitely has an impact on people as well. And then pre-existing conditions among adults and children. In my clinic, sometimes during the first NCO, people found it challenge to actually get to see me or to see the other doctors that they had appointment with, and had to make a lot of explanations to the roadblocks that they had to experience through the way. Of course, now it's much more seamless, and it's much easier to continue with follow-ups that are essential. But pre-existing conditions, if they're not attended to, can also decrease the immunity of individuals, increasing the risk of contracting the COVID-19 infection as well. And of course, currently the uncertainty and the waiting for many people for the vaccine as well. And now, as we all know, the impact on healthcare. Right? So, a lot of other conditions that are equally disabling and affect individuals are now put on the back burner and not actually attended to. So, I think it's important to first reflect and do an audit, identify what is actually under our control and what is not. I mean, for us to actually keep thinking and worrying about when will I go on my holiday, when can I travel overseas. That's not under our control. So why should that be factored into our thought or mind frame? How is that going to benefit us? And so instead look at, okay, what can I do currently that actually can help me feel comfortable and less stress? If we used our holiday and our going overseas as a way to cope with stress, we need to find new ways there. And then identify what's areas in life that can actually impact on your mental health. Is working from home an issue for you, or you find it, quite easy to do? Is maybe having too many breaks and eating, overeating an issue for you? Is that something that you need to? So that's making an audit, and I typically recommend to my patients do an audit weekly. Identify what you've been doing over the week, what you have achieved, what you couldn't achieve, what your emotional state was, and how things can improve going forward, so that you're not just doing, groundhog day every day, right? Uh, and then, of course, we need to maybe reflect back on how we were actually coping with things even prior to this pandemic. Were there moments when in the past we experienced anxiety or negative thoughts or even feelings of depression or hopelessness? And if we didn't, are we actually maybe experiencing them now? Some of the observations, I think, from my perspective, is one, that there's a silver lining as well from all sort of hardships that everyone goes through. The silver lining that I can sometimes take away from this is the fact that now there's a bigger emphasis on mental health, which we've been pushing for years. We've actually been pushing for more resources, for more funding, for more human resources in dealing with mental health in Malaysia. And now the years have opened and people are actually identifying that this is an issue. My patients themselves tell me that they feel they're not so alone anymore, that everyone around them is just as anxious as them, and everyone else is feeling stressed and worried, and so they're not alone and they don't feel, stigmatized because of what they experience. Of course, the sad thing is there's been an increase in suicide and suicidal thoughts. The police have recorded 468 cases in the first 5 months of this year. And there have been about 1,700 cumulative deaths by suicide since 2019 till May this year. The shocking thing is that half of them were aged between 15 and 18. We're losing young people. I put the blame on one, not focusing or emphasizing on mental health in children and adolescents as they grow up. In some countries, it's part of the curriculum. I mean, if you want to build someone to have life skills, why omit mental skills? Mental health skills is one of the most important of all life skills. So if they actually knew about how to deal with stress and be more resilient, we may not actually lose them to suicide. I think the other fault in the whole system is accessing mental health services. And that can be quite a challenge for a young individual. Sometimes in my own practice, a big uh, sort of obstacle to actually young people getting help is their own parents. Because the parents think it's all put on, it's an act, it's drama, it's to get attention. But children don't want to get attention all the time. There are times when they suffer and they need help. And that help may not actually exactly be the immediate family, and they need professionals. So, yeah, so these are some of the factors why we are maybe seeing a higher rate of young people um, losing their lives to suicide. Of course, the other thing that I've observed in this period is relapse rates of common psychiatric conditions because of the lack of follow up or continued treatment have increased, and also substance use. The other thing that has also maybe been neglected for a long time is the stress of our frontliners. In fact, healthcare professionals actually suffer more stress on normal days, even without a pandemic, than most other professions. And so, what have we done to actually support them? Thank goodness now we have several different agencies that have come forward to support the mental health of our frontliners as well. We, in fact, did a study looking at medical students and general practitioners to see if there was a difference in terms of their anxiety about contracting the disease. And we found that it was almost equal. But that 73.6% of healthcare professionals and medical students felt that it had a moderate to huge effect on their daily life and caused them anxiety. We did another survey which just got recently published in the British Journal of Psychiatry, and this was the impact of COVID-19 on the psychological general well being of an individual, of healthcare workers from around the world. We looked at healthcare workers from Africa, from Europe, from the Americas, from Eastern Mediterranean, Southeast Asia, and the Western Pacific, and found that 71 or 32.7% were having high levels of severe distress in terms of their psychological general well-being. So we actually put recommendations on how to support them and provide them the mental health care that they need to continue their frontline work as well. But there are positive stories. I mean, the previous lockdown that occurred during the plague, Isaac Newton actually discovered gravity. That was a time when he experimented with prisms. And he actually invented new things during that phase of the lockdown. So, we should maybe take from this and instead of being that bored couch potato watching reruns of Netflix, we could be like Newton. Also, human beings have an incredible ability to survive and adapt. And most of it is through what they do for others in a cooperative means. This is a friend of mine who actually runs a restaurant. He gives out about 200 free meals a week, and it's donated to the poor in the community. Uh, so basically, evidence actually shows that helping others through a charitable activity actually benefits our own mental well-being. Giving makes us feel even more, sort of gratified as well. So good thing is we don't have to watch him anymore. At least we can know the real information. But as I mentioned, information overload can actually cause anxiety. So what I typically do is I leave all my information on COVID till maybe the evening time, just before my exercise routine, so I can digest some of that information and then go and de-stress with some exercise. Pick and choose your time. You don't have to be consuming everything every moment. You can be in charge of the information that you receive. People sending that information are not under your control. You may have 23 groups or 50 groups and everyone sending something at the same time. You don't have to consume all of it. So I think it's important to be in charge of the information that you receive. The other thing that I also continuously do is to connect and reconnect because I know good relationships are important for our well-being. I mean, we're all social animals. Like it or not, being social is part of our build up as a human being. And it has a huge benefit in terms of support for ourselves and also in building our own positive outlook going forward. Here we're celebrating a close friend's, I think it was his 55th birthday. Yeah, so at least he didn't get left out, and we did it online. So I think there are a few things that we need to address, and maybe take into consideration not just our physical health and how many masks we're putting on and how often we sanitize our hands, but also our mental health, because we know that mental health and good mental health actually improves our immunity. It can protect us, maybe just as well as the mask. So I think the important thing is to maybe reflect on how much sleep are we getting, are we actually eating healthy, are we exercising regularly, are we taking care of our physical and emotional needs and those around us as well. So stay physically distant is important, but not maybe socially distant. And we need to see how we can use different mechanisms to stay socially connected. And of course, assess life regularly and manage our stresses. One of the things that I worked on also during the last lockdown was on my publications, and I felt proud that we could, together as a team, actually come up with three new handbooks: one on anxiety disorders, another on depression, and a third on recovery in mental health. And that was in a span of about 3 to 4 months. So I reinvented some of the things that I was doing for myself and got my colleagues to work with me together with trying to achieve this. That's something that we can actually look at, see what we can try and build into our lives so that we can actually achieve something, even though it's a lockdown and we're stuck at home. There is an online course which I did myself, and I would recommend strongly to others as well. It's available on Coursera, which is a free course online site. And of course, you have to register, but there's no charge. And this is a course by the University of Pennsylvania, which actually helps you understand mental health and also know how to build your own mental health as well. The other good mental health uh, habits and conditions is actually building a schedule, a routine, and also focusing on religion, because that is definitely going to provide support through this whole phase of uncertainty. There are many apps that we actually utilize now, and I often advise my patients as well. Uh, these apps are actually tested and tried and known to be useful. Some of them are even free. For example, the Simple Gratitude Journal is a free app which you can download on your phone and is known to actually benefit in terms of good sleep as well as a positive outlook and challenging negative thoughts. Relaxation techniques are really useful in dealing with stress. And if it becomes a part and parcel of your daily life, you actually keep mental health more positive as well. Sleep hygiene is basically steps that you can do on a regular basis to change lifestyle to improve your quality of sleep. The first would be to avoid gadgets half an hour before sleep because the light from the gadget actually affects your quality of sleep. To avoid daytime naps unless it's less than half an hour or half an hour and less. To make sure the bedroom and bed is for sleep and sex, but not other things like browsing the internet or watching TV. To set the time to wake up because that's more important than setting the time to sleep. If you set the time to wake up, you sort of build a body clock in yourself. To control the amount of caffeine that you drink, no more than 2 cups a day in the last before 5 p.m. Exercise regularly about 4 to 5 hours before you plan to sleep, and eat a light dinner because you don't want your body to be busy digesting while you're trying to go to sleep. Make your lunch the bigger meal and dinner a light meal. Have a warm bath about 2 hours prior to sleep. It sort of tones your body into that sleep process. And cut down on alcohol prior to sleep as well as cigarettes. They're both stimulants in small doses and can also affect your sleep. And avoid gadgets near your sleep area. So even the little charging light can actually affect your sleep. This is a good resource for sleep hygiene techniques, the webmd.com. They have a fantastic presentation on what you can do to make sure your sleep is of quality. So these are some of the other tips that I would like to suggest. Some I've mentioned earlier, but basically a routine is really useful. But keeping active uh, and know what your red flags are. Learn new skills, start new projects, and maybe even learn to cook if you like. But communicate with others and stay informed, but restrict your source to the ones that you know are dependable. And of course, be mindful that that we can all do this together, but we need to focus on the things that are under our control and not just go on to herd behavior influence. So as Dan Burke actually suggested, there are different zones that we can go through during this whole COVID pandemic. And the first, I think we've all been there, done it, and hopefully we've gone through that and now moved on to the second or third. But the first period is where we're all fearful and anxious, where we complain all the time, we spread negative emotions, we grab all the food and toilet paper we can, we're hoarding things. And then we go into that learning zone where, okay, let me come to terms with this. Let me identify my emotions and evaluate the information before I spread it out or recognize what we can actually do. And then the growth zone, where we can actually think of others and see how to help them through. We can live in the present, focus on maybe things in the future as well, and keep a happy and emotional state. So that ends my presentation, and thank you for your attention. I'd like to just end with these care lines that the National Coalition for Mental Well-being, which I am a member of, has come up with to help people know where to get help. So some of these helplines are actually 24 hours, some are just restricted to certain times. Most of the helplines that I'm showing here are for adults. There is a helpline for children called Buddy Bear. I don't have that number here, but it's available online. These are some of the online tools that I would strongly recommend. WebMD, as I mentioned, has a lot of information on common mental health conditions and sleep hygiene. These two sites are actually for online therapy. So if you're finding it hard to go and see a psychologist, a counselor, and you're looking at therapy for some of your conditions, these are AI-powered online therapy sites. They're run by universities in the Australia and in the US. Of course, they are chargeable, but they're authentic and reliable. There are several apps, which I mentioned earlier, Gratitude Journal. There's also Sunvelo, which is currently free to use. It's a meditation mindful app. You learn skills to build your mental health resilience and deal with stress. And also there's Headspace. There are a few others like Calm and Waking Up as well, but I didn't have much space to write them all down. Make use of all these. I think you'll only benefit from them. Okay, I stop here for questions.
Thank you so much, Professor. That was so amazing. I would like to. I took down some notes from your slides.
Yes.
I like the part where you said, "Stay informed, not overwhelmed." That is true. You know why? Because in our culture now, when there is a news, it travels faster than, especially this COVID news, right? It travels very fast in the sense that, oh, somebody died here. So even they died out of heart attack, they say, no, it's COVID. So yeah, this is like overwhelming news, especially the rates where the cases are going high. And then I like when you said giving helps in our mental health as well. But I believe giving, if let's say you don't have the means, you can also give a simple gift, which is a smile, and also a helping hand. And yeah, I like that as well as thank God for technology where we have Zoom. I'm sure Zoom and all this is a way where we stay connected and all. Okay, thank you so much, Professor. I think there are questions coming up. So before the question, I would like to ask one question, right? What scale would you suggest for screening depressive and anxious symptoms? Like you have a family who's, you feel they're showing the symptoms, but how would you say yes, they're going through depression or anxiousness?
So the different scales that we typically use, the thing that you have to remember is scales are not confirmatory. They don't make a diagnosis. They're only screening. So they may suggest that there is a mental health problem. One of the common scales that is used in primary care is the DAS 21, or Depression, Anxiety, Stress Scale. 21. It's got 21 items. It's usually actually administered by a healthcare professional. There are some scales that are self-administered. For example, the Zoom self-rating depression or self-rating anxiety scale, and you can score your own scores.
Okay.
But again, it is not confirmatory and it's not a diagnostic tool. So you need to use that maybe to then see what you call a mental health worker or general practitioner to confirm.
Okay, sure. So, if let's say they can't afford private sector, so can they get this help from government hospitals, like for those who are going through financial problems?
Yeah. So, I mean, sadly in Malaysia, it's something that we've been trying to fight for years. Uh, Mental health is not covered under insurance. So you take an insurance policy, it covers for all your medical conditions, but surprisingly, it won't cover your mental health condition. But these insurance companies are actually international, they're multinational companies. And in other countries, they cover it. So there seems to be some sort of prejudice that they are, sort of showing towards people, from here. We've actually discussed this with many authorities. I think some insurance companies are now coming around and covering some mental health conditions. But because they're not covered, of course, it'll be seen as an expensive,
Yes.
sort of treatment option. So yeah, so for those who have to pay out of pocket and can't afford, the thing in Malaysia that is so great about our healthcare system is that we have specialists that are available for ringgit at government and public hospitals.
So,
Yeah. So as long as you have a referral letter from a clinic kesiapan, you can actually be referred to a psychiatrist, who then may decide whether you see a psychologist as well. But yeah, this can be done in a public hospital.
okay, thank you so much, Doctor. That's so good. So can we look at a question? Okay, it's from Ishwa Khanna. An adult in my life seems ill and won't find help. What can I do?
Yeah, so one of the things about mental disorders is that some of them are ego dystonic, and some of them are ego syntonic. So the ones that are ego dystonic, that means the person feels there's something wrong with me. I need to find help. They would maybe be willing to go and see a professional. But those who, those conditions which are ego syntonic, they may say there's nothing wrong with me. I don't feel anything wrong, but everyone else noticed the change. So some of the serious conditions that are ego syntonic include bipolar disorder in mania. Patients love their mania and they don't think there's anything wrong with them. And they will not come willingly to see maybe a professional. Or those with schizophrenia, where they believe what they're experiencing is real and they don't think there's anything wrong with them. There are, I mean, if they do get to a stage where their condition becomes dangerous to themselves or to the others, then admission would be warranted, and that is usually to a psychiatric ward. Usually, with the first admission, the healthcare professionals can work on building their understanding and knowledge and insight, and then they can start to maybe know about their illness and be compliant. But otherwise, even families can come to see the professional to discuss steps that can go forward to help them get, to treatment as well.
Yes. Okay, next question from Carmen Wong. Someone I care about is talking about suicide. What should I do?
Yeah. So the first important step is not block that person from communicating with you. It sounds like that person trusts you and is talking to you about something that is very serious. You need to take them seriously as well. Unless you're a mental health professional, you're not going to treat them or tell them what the remedy is. Do not counsel people unless you're a counselor, right? So all you can do is actually to let them ventilate and talk to you. And that way they can maybe feel their burden reduced. You need to maybe then suggest that there is help available. If they're not in a position to look for that help, it may be good to take that extra step to find out what are the places that that friend of yours can find help from, which is the clearest, nearest, mental health service. Who can she see or he see? Can you help them to make the appointment for them? Would you offer to, maybe a bit challenging to go for the first time? I'm happy to come with you. So offering these things are useful. If you feel that the person is serious about their suicide or that they want to take their life, you need to break confidentiality. You cannot just keep that to yourself. You need to inform the family. You may need to also inform the police if the person's suicide risk is high. So typically we divide suicide risk into low, medium, and severe. So in low, it could be just talking about I wish I died. In medium, it could be I want to try and do something. And in severe, it is already made plans on how to maybe take their life. So if you're concerned that your friend may be severe, you need to break confidentiality, inform the nearest kin, and also the police.
And also don't take it lightly, as you say, doctor.
Yeah.
Okay, our next question is from Aisha Khanna as well. I'm worried about my child or teenager. Where can I find help?
So if it's a mental health issue, we have several child psychiatric units in the university hospitals, UKM, UH, and also in the public hospitals, there are child psychiatric units. Uh, in private, there are child psychiatrists in several private hospitals and child psychologists as well. So depending on the age of your child and teenager, I think these are the places that you want to look for help.
Thank you, doctor. Our next question is from Ms. Audrey. How do I distress after a long day at work and coming back home to see house chores are still undone? That's a good question. Thank you
Yeah,
so much.
yeah. Okay, well, the good thing is you're getting to get out of the house for work, right? You're
Yes.
not working from home. So you may need to count your blessings. You are at home and there's so many house chores and there's work to do, maybe even more challenging. How do you mix and match all those things together? So I would say, first and foremost, what is priority? So when you come back from home, it's just taking a break and resting and relaxing more important than actually getting down to doing all the nitty gritty of the house chores. Or can house chores be sort of delegated? Can other people be involved? Or is it your characteristic that you need to attend to? Are you maybe a perfectionist that needs to see everything neat and tidy and done on time? And can that change? Can you accept that maybe at this time on stage during this whole pandemic that maybe you need to give in a little bit and it's okay for things to be a bit messy,
Messy.
to be a bit, unsettled, but they will eventually come around. So I think it's important to identify where is this coming from. Is it that the house chores were always an issue? And then is it you? Or is it only recently things have changed? And then is that something related to the family? Can there be a family meeting? Can everyone work together on this? Or, can you maybe look at, changing a perspective about these house chores as well?
I think most mothers go through this where they go back and the house is in a mess.
Yeah.
So I think it's okay to let go. It's okay if the house is a little messy.
Yeah,
Okay.
I agree. I just want to add on. I think a lot of mothers also fail to realize that doing house chores is not exercise. It is not actually stress relieving. right?
Thank you,
And
doctor.
doing
That
house
helps.
chores. Yeah, doing house chores was stress relieving. I think we'll get even men to do it all the time, right? Yeah. So even if you're doing house chores and you're doing work, you still need to go exercise
Exercise.
physically,
Mhm.
do meditation, do mindfulness, all the other things that help with managing stress.
Okay, thank you, doctor. Okay, Ishwa Khanna. Someone I love has been diagnosed with depression. How can I help?
Yeah. So I think if you actually care about this person, you want to find out more about depression yourself. What is this condition? How do you actually support someone? Don't give them the to-do list. Okay, do this, do this, do this, because you're not the professional, right? You support them through what they need to do in trying to get better. Like, okay, do you need reminders for your medication? Do you need maybe someone to accompany you for exercise? Do you want me to enroll you for like a yoga class? Would you like to, work on some of these apps? So give them tools, but also see that they are, encouraged to use them as well. Don't give them the solutions. The sad thing in Malaysia is a lot of people think depression is a weakness, and they have all the, sort of advice that they can give to somebody with a weakness. So you need to wake up early, you need to do more work, you need to do this, and people feel that that's even more stressful, makes the depression worse. So I think we need to be careful about what we speak to them on.
Yeah, I think we have, what you're saying is we have to be sensitive to what are their needs.
Yeah,
At the same time, we don't react.
yeah,
Okay,
yeah.
shall we go to the next question? Okay, in time of uncertainty, and maybe by today another extension, any simple way to control mindset at home?
Yeah. So again, I mean, you waiting for the lockdown to be over is not under your control, right? Unless you are next to the people who make those decisions or you're the advising them. So I would suggest maybe focus on other things. Okay, the lockdown is here, the numbers are going up still. Let's just focus on what we do during the lockdown. How can I manage my time, my energy, my efficiency, everything else that is currently going on, and not wait for that moment to open up, right? So yeah, I think focus on the here and now, be aware of what's under your control and what isn't as
Okay. From Michelle Tian, how do I cope with my toddler who is locked up?
well. Yeah, well, I mean, if
Mothers.
yeah, well, one thing is who decided that he or she is locked up.
Mhm.
Yeah, is that a terminology that you came up with, or that she or he came up with?
Mhm.
Because that sends a negative message.
Mhm.
And so it's not locked up. You're at home. You're safe. You're in a
Yes.
positive place. How can you put that as a lockup? I mean, lockup is like the prison, right? You go to jail, and that's a lockup. How can you describe your own home as a lockup? So first change the terminology, then make it positive. Let's look at the home as being a positive, environment for my own child and for all of us. We have a play area, we have board games, we have these things. So exciting things can be put into the day. Well, of course, children need to know, toddlers need to know there are routines, there are schedules. So you have your work. You at that time they cannot be playing board game. You have maybe house chores to do. That time they can't be asking you to read a book. So you set a schedule, talk and negotiate with them. Even a toddler can give you ideas. You can say, no, mommy, I rather play after eating lunch. So talk to them, make them feel that they're involved in the decision making, and then fix up a schedule that works for the whole family, and then make that exciting. If you're not in an ACMO area, I think you can go out for walks, and I think that's essential. Exercise with your toddler actually helps you build your relationship.
Yes.
Because when toddlers actually start to exercise, their dopamine reward pathway is stimulated, and they open up and talk more to you and feel more comforted by you. So yeah, I think encourage to do all these things, and definitely don't put that word lock up in your home, right?
I think it's because now with the restriction, we can't go to the playground. But I think it's still walks also are now restricted now. But I think they can still play in the porch. Like we used to have a routine every evening. We go for a walk,
Yeah,
and then after that, it came to at this time where you can't go for a walk. You can't step out of the house.
yeah,
So as you say, yeah, we can have our own routine in our house itself.
absolutely.
Thank you so much. Can we have a few more questions? Hi, doctor. How do I balance washing my hands or not becoming obsessive about it?
Yeah, okay. Well, I think the important thing is to do it realistically. Obsessive compulsive disorder is unrealistic compulsions. So my patients actually describe washing their hands 300 times a day because I actually ask them to record down. The moment they wash their hands, they come out, they feel no, it's not good enough. They go back and wash again. And then they come out and then no, not good enough. So they may repeat continuously, but it's irrational.
Mhm.
There's no rational reason for it, right? So I think we need to wash our hands as often as possible. And that's recommended to avoid the spread of the virus. But when you are doing it irrationally, that means you just done it and you're doing it again and again and again, then it's more than just normal, sort of behavior to help with the pandemic. Yeah, so I think most of these repetitive behaviors that we have now are mainly to cope with the stress, but also recommended to prevent the infection spread. They don't normally become obsessions. And in fact, when things get better, you might notice you're back to washing your hands as less frequently as you used to before.
Okay, in interest of time, I'm afraid we won't be able to address any more questions. Thank you for keeping questions coming, and we seek to answer the rest of the question by replying in your comments. Before we end, I would like to add something. Now that we can't smile and we can't look, we can't express ourselves. There was this once when I went to a grocery store. So there was this guy who was scanning all the things. So I smiled, he didn't look. So I said, "Good morning." And then he was like, at this situation, everybody is just not looking at anybody. If I look at you, I'll get COVID. If I look at you, I'll get COVID, that kind of situation. So I said, "Good morning." And then the lady before me, she said, "It's so nice because I can't see anyone smiling. You have to either squint your eyes more or you can't see it smiling." So I went extra mile. I told the lady, "Come." It was an old lady, Auntie Sue, who is 80 years old. So I said, "Auntie, I'll walk you to the car." I was holding her trolley and she was walking. And then I asked her, and then she asked me, "So what are you looking forward after the lockdown?" I said, "Maybe go for, a holiday or what." And what she told me really impacted me a lot. She said that I've got grandchildren in JB. I have my children all over. But I really thank God that I can do things for myself at 80 years old. And just before I pass on, I would like to have a celebration with them. So that I was thinking, wow, okay, so this is something small little things that we can do to cheer people up. So yeah, there are every little thing we can thank God for. So since we have reached the end of session today, thank you once again, Professor Philip George. Please don't forget to like this and share. Don't forget that we are all in this together. If you need help, please seek for help. And those who are willing to help, please reach out and look out to make someone's day. You might not know a smile or a gesture of love can change a person's day. So don't forget, like and share. Have a nice day, everyone. Thank you, Dr. Philip George.
Thank you, Sharmila.